Okay, so we know that presbyopia is early signs of aging, and it remains really fascinating to see that what is the global burden to presbyopia. It's about 1.08 to 1.09 billion people affected every year. And if you see United States, the number of people who are uncorrected presbyopia is very, very high, and it affects the gross GDP of the country. Why it is mysterious for presbyopia? We really don't know what's the primary factor why people lose near vision after certain age. Whether it is because of the molecular effects, the biological effects, the genetic effects, exact mystery is not known. And that's why there's so much of variability when the onset and severity of presbyopia. So everybody who knocks 40 does not become presbyopic. So there is a variation. The modern life, the effect of COVID-19 has also affected presbyopia, and now we see more and more people going into presbyopia at younger age. If you look at the anatomy and physiology of presbyopia, it's primarily the ciliary muscles which lose their function with age, and because of deposition of fibrosis around them, both in the circular and the longitudinal fibers of the ciliary muscles, and the lens fibers which hardens with age, the anterior capsule becomes less elastic, and the vitreous actually gets liquefied. So the posterior support which the lens gets from the vitreous liquefies with age. There's also oxidative changes, minor elements which keeps the lens healthy, goes down with age, and the presbyopia is one of the reasons for that. The most important point about presbyopia is the neurophysiological control. And this varies from individual to individual. That's why the presbyopia amplitude can be different at different age group. We know that aging causes presbyopia, but there are other factors. For example, diabetes, multiple sclerosis, heart disease, myasthenia gravis, patients on various drugs, for example, antihistaminics, antidepressants, diuretics. These patients can have presbyopia early in age. We know that various modalities of treatment for presbyopia, we have already discussed that. We know spectacle is probably the cheapest way to correct presbyopia. The problem with spectacles is it's not very close to the nodal point. So it has distortions, it has aberrations. Coming to contact lenses, yes, it is another good choice, but it has problem with decentration and again aberrations. We have a lot of experience with presbyound. It's a good technique, but it has its own limitation. Of course, we need to check for dominance and try and correct it based on dominance, stereopsis, and acceptance. It does have night vision issues, even with presbyound and other laser procedures. Coming to corneal inlays, it was once very, very popular. Unfortunately, it went with complications, and nowadays it's not that popular anymore. Multifocal IOS has already been discussed. Coming to controversies, one of the things which is going to be more and more popular is coming to drugs, which is going to be the next generation of correction of presbyopia. The problem of pilocarpine, low dose, is that we still don't know how effective it is in correcting presbyopia and what are the long-term disadvantage. For example, retinal detachment, persistent headache, eye strain. These are one of the problems of pharmaceutical industry. Genetic therapy, we know that probably one of the ways to correct presbyopia is by modulating the mitochondria and making yourself younger, and that will of course be a future study on presbyopia. This is the Clarity phase 3 trial, which is, for example, the LNZ100, which is going to be prescribed next year. We don't know the exact pharmaceutical name still, but that's going to be a revolutionary change in treating presbyopia patients. There is one therapy which has been very popularized by Professor John Marshall from University College London, which is a laser treatment. It actually works on the longitudinal fibers of the ciliary muscles, which goes and attaches to the Brooks membrane. You create small perforations on the sclera, and thereby the anterior and posterior displacement of the lens is sort of modulated. And this has a dynamic effect on presbyopia. So all these modalities of treatment which you have seen, for example, by correcting with lenses, they are not dynamic. they have their restrictions. So that's why we struggle to see far, intermediate, and near. Whatever permutation combination you do, you never achieve what your normal lens gives you. And that's the dilemma. Can we achieve that? So coming to presbyopia, it remains a challenge till we get a perfect answer. Thank you.